The situation in India has gone from bad to worse. We were shocked and distressed when India crossed 1 lakh COVID-19 cases that forced us to start this channel. Nowhere in the world, in a fortnight's time, we are adding something like 3 lakh cases per day, and more than 2,000 people have died or dying every day because of COVID-19. The situation in India is bad now. There are no beds in the hospital and the people are distressed. There is no oxygen available, no beds, and doctors are overwhelmed, and India is not able to take. The politicians are failed, they have failed, and they are not able to do, they are not getting any solutions how to come out of this. The whole world is watching India. Now let's talk about, in this video we are talking about, in the first surge, it was India never crossed more than 98,000 cases per day. And now it started with 1 lakh cases per day. Gradually it has gone up to 1,50,000, then gone up to 2 lakh cases now. And now we have crossed 3 lakh cases as on today, and more than 2,000 people have died. Now, the difference between the first wave and the second wave. In the first wave, there was no struggle for oxygen, and there was no struggle for people to get beds. And that time there was a lockdown of 2 months, and everything was under control. Now in the second stage, in the second surge of COVID, people are dying because of lack of oxygen. Let's see, why do we need a supplement oxygen now? Do they really need it? Now what's happening? Let's see how the COVID-19 or coronavirus affects you and what forces you to take oxygen. See, when the SARS COVID-19, or we call it as coronavirus, when it attacks directly your respiratory tract. When the respiratory tract, in the respiratory tract you have epithelial cells, and the function of these epithelial cells is to protect the respiratory tract. When these pathogens attack the epithelial cells, there a kind of fight takes place between the pathogen or the coronavirus or any other viruses and epithelial cells. You remember in the last video we discussed about immunity, immune cells. Immune cells, they generate antibodies and help the epithelial cells. As a result, there is inflammation happens in the respiratory tract. And moreover, if it continues for a long time, the fight between the epithelial cells, antibodies, and the pathogen, maybe coronavirus, then it blocks the respiratory tract. At the same time, when this is happening, inflammation takes place and other fluids are generated automatically. All these add to the fuel. So as a result, the respiratory tracts get choked up. So that's why the need of oxygen comes. Now, what is happening? Earlier, the situation was not that bad because the cases were not coming that many. Now they have crossed 3 lakh cases. Obviously, many of the peoples need oxygen supplement. They need it, otherwise they're going to die. They will be having this distress syndrome of respiratory tract. So definitely they need oxygen. And now the thing is, compared to last year, according to the COVID task force, Now in the second search, more than 57% of the people need oxygen supplement, need oxygen to survive, otherwise they're going to die. And now according to some parameters, if your oxygen is coming down level of according to oximeter, if it is coming down 92, so I'll just see the exact data. So that is according to this, now as on today 21st oxygen, people are on oxygen beds, and now there are cases of 3 lakh. And according to National COVID Task Force, I told you 54.5% of the people need oxygen. And now what is happening? And now oxygen saturation level, if it comes down 94%, definitely you need an oxygen supplement. So the target is why they give you the oxygen supplement. Again, they take it to your oxygen level to 92 to 96%, or in case of chronic obstructive pulmonary disease, 88 to 92%. So this is all because of your lungs. So the main function of this respiratory tract or your lungs, say the oxygen comes through your lungs. This is a tiny sacs inside your lungs. So whenever the oxygen comes inside the body, right, they expand, and the oxygen they accept it and they give it to your blood cells and all over the body. And the carbon dioxide, what do? They accept, they inhale oxygen and carbon dioxide, they throw it out. So, and this oxygen they supply through all over your body through the blood cells. So that is how it happens. So when this respiratory tract gets infected, so then you definitely need hospitalization and you need oxygen. Now my take here is, it's not necessary that everyone affected by corona need oxygen. Check your parameters, check your pulse, oxygen. So it's not necessarily right. So only in case of, first you consult your physician. In case of severe respiratory tract distress syndrome, you can go to the hospital, otherwise not required. As it is, the hospitals are overburdened, the doctors are stressed, you won't be able to get, that leads to problem, that leads to shortage of oxygen. Take care.